Dear medicos, let us discuss the ENT segment. So I have taken all the recall options. Let us discuss the first MCQ. Which fungal infection is most commonly seen in maxillary sinus? Class notes. And I'm very happy in this examination all the questions of ENT segment are from the class notes. Revise gold standard class notes multiple times. First line of the topic of sinusitis was the infection in rhinology is viral more than bacterial, more than fungal. Which virus? Rhinovirus. Which bacteria? Streptococcus. And fungus? Aspergillosis. Which aspergillosis? Fumigatus. So answer will be your option A. I hope you are getting my point. Examiner can ask you the most common site for fungal ball formation. Then answer will be maxillary sinus. Fungal ball formation most commonly site will be your maxillary sinus. And which fungal infection in maxillary sinus? That will be aspergillosis fumigatus. Now examiner can confuse you. Why? Otomycosis. There will be having aspergillosis niger. In nose will be having aspergillosis fumigatus. These are two often repeated MCQs. Coming to the next one, question number 2, taken from otology. A 30-year-old patient with complaint of vertigo on loud sound. Very important keywords. If you remember in the class notes, we have revised this concept. Vertigo on loud sound means patient is uncomfortable with loud sound. Which phenomena is coming? Now the option vertigo is coming. It can be cochlear, it can be retrocochlear, it can be sensory or neural. So if the patient is of sensory deafness, the patient will be having vertigo on loud sound. What we call it as which phenomena? That is a oversensitivity. The patient will be having discomfort in a loud sound. That is your Tullio's phenomena. And what this oversensitivity known as recruitment. So if you remember the class notes, recruitment phenomena is the oversensitivity because of which the patient will end up with discomfort. Sensory patient. So one point is the patient diagnosis is going in the favor of sensory deafness with blowing of the nose. This typical history of blowing of the nose, loud sound, patient going to a marriage function and patient have vestibular symptom. All these are going in the favor of Meniere's disease. So option C will be the best option. Now let us see with the other points. BPV, benign paroxysmal position vertigo. Patient will be having vertigo in a specific position, or the examiner will be giving you a clue, vertigo few seconds. That will be the key word for BPV. I will not be going for BPV option, but let us revise this topic for the upcoming examination. Which canal is involved? Sir, posterior canal is most common. Clear? Now what is the pathophysiology of BPV? So loose autoponia, calcium carbonate bodies, they get displaced into the semicircular canal. So patient is having some vertigo in a specific position. Why benign? Because it is a few seconds. What will be the investigation of choice? Hall-Picks maneuver, and treatment is Laplace maneuver. Option B, superior semicircular canal dehiscence. Very important topic for the upcoming examination. Which canal is involved? Obviously the word itself is telling you superior canal. What will be the key word? Key word will be conductive deafness with CNS manifestation. Conductive with CNS manifestation. Labyrinthitis, inner ear inflammation. The patient will be having some history of upper respiratory tract infection, followed by the patient will be having some vestibular symptoms. That will be the D option. So I am just trying you a way to rule out the other choices. Clear? So all my FMG students, beta, this last FMG have proved that if you learn the concepts, revise it multiple times, very easy to crack the examination. So please beta, focus on your class notes, revise them multiple times. Multiple revision, key to success. Coming to the next one. So what pregnancy is visible to me? I will not be reading the question. I will be going more in the favor of autosclerosis. Important point, the diagnosis of autosclerosis, but let us read the question. Now, young woman with a history of progressive bilateral, keywords beta, fluctuating deafness. Answer will be Meniere's. But if it is bilateral progressive hearing loss with aggravated in pregnancy, answer will be in the favor of autosclerosis. On examination, tympanic membrane was intact. What should be done to rectify this? Now just try to learn this point. Answering this MCQ, what is the treatment of autosclerosis? We go for stapes surgery. What stapes surgery? 50 years back, stapedectomies. Now we are doing stapedotomies. Clear? But in the option, stapedotomy was not there. Any student, if stapedotomy was the option, that will be the best choice. But if stapedectomy was there and the examiner was trying to confuse you between tympanotomy and tympanoplasty, so we are going for tympanotomy. We are opening the middle ear and we are removing the sclerotic foci with stapes. But tympanoplasty is a management for your tubotympanic saphere. So it is nothing to do with otosclerosis. So option D is a false statement. Conservative management, no, until unless there is a contraindication, will not be going for conservative management. Tympanoplasty is a treatment for CSOM. Okay. Schwartz sign, very important finding in otosclerosis, right tympanic membrane, which give you a message that there is active foci inside. Then we will be going for conservative management. We will not operate if your Schwartz sign is there. Okay. I hope you're getting the important points. Otosclerosis beta, all my students, MCQ, there are 10 to 15 keywords which you should revise multiple times. Okay. Coming on the next one, question number 4. Bone anchored hearing aid. Conventional hearing aid BTE behind the ear, in the ear, we are keeping in the external auditory canal. What is bone anchored hearing aid BAHA? We are keeping on the mastoid. Why we are keeping on the mastoid? Because we can't keep in the external auditory canal. Why you can't keep in the external auditory canal? Why I'm not using the ear conduction? Why I have to take the help of bone conduction? Because my ear conduction is not available. Well, like canal atresia, canal stenosis, pus in the canal. So what are the 3 important indications? Pus in the canal, canal atresia, canal stenosis. And out of these 4 options, the option D will be the best choice. I'm understandable. But when I was discussing this MCQ with many students were saying, okay, sir, atresia option, if atresia option is not there, then what will be the best choice? Acoustic neuroma? Not at all. Acoustic neuroma will be going for brainstem implants, beta, brainstem implants. In sensorineural hearing loss, there can be a possibility. Yes, there can be a possibility of bone anchored hearing aid, but in this MCQ, with these choices, the best option will be the D option. Again, from the class notes beta. Coming to the next question, number 5. 60-year-old male with a history of chronic smoking with unilateral epistaxis, or the change in voice, headache is there, difficulty in swallowing. On examination, there is a cervical lymphadenopathy. Just try to learn beta. Connect the dots. Cervical lymphadenopathy, unilateral, 60 year. I have revised my notes multiple times. 60 year, unilateral cervical lymphadenopathy, nasopharyngeal carcinoma. Clear? Bimodal distribution. Just remember, if examiner can give you 20 years, it can be seen in 20 years, it can be seen in 60 years, associated with Epstein-Barr virus. Yes. What is the most common site? Fossa of Rosenmuller. What will be the symptom? What will be the presentation? Middle ear symptoms, yes, are there. If there is a glue ear with 5th and 10th nerve paralysis, 5th and 10th nerve paralysis, that is your Trotter's triad, going in the favor of nasopharyngeal carcinoma. So just remember, Trotter's method is epistaxis. Trotter's triad, if examiner asks you, nasopharyngeal carcinoma, that is a glue ear with 5th and 10th nerve paralysis. Okay. What is the treatment of choice? Is your radiotherapy followed by chemotherapy? These are the treatment option for nasopharyngeal carcinoma. Coming on the next one. Yes, coming on the next MCQ, which type of fracture is shown in the image? So better what I'm showing you, there is a breach at which level? There is a breach, there is a trauma at here, floor of the orbit, we call it as orbital floor fracture, blood fracture of the orbit, teardrop sign. Just remember this one. In this patient, we get an image like tear is falling down, teardrop sign. Option will be here, option A. Clear? Now let us crack the other options. Option B, leaf foot fracture. What is leaf foot 1, leaf foot 2, leaf foot 3? Just remember the concept. Leaf foot classification is based on direction of fracture line. Like if the fracture line is along the floor of the maxillary sinus, we call it as leaf foot 1, and if it is at the level of orbit above the maxillary sinus, we call it as leaf foot 3. So it is on the basis of direction of trauma. And leaf foot 2, what is leaf foot 2? If the fracture line is along nasolabial fold, it is here leaf foot 2 fractures. So leaf foot classification is your direction of fracture line. Chevalier fracture, Jarjobe fracture, they are on the direction of trauma, like trauma is coming from below, so we call it as Chevalier, class 1 fracture. Trauma coming from front is class 2, that is your Jarjobe fracture. What is tripod fracture? The facial fracture, again zygomatic fracture. The 3 areas are involved, so we use a word tripod fracture. So option A will be the right answer in this MCQ. Clear? Coming on the next one, a diabetic patient. Diabetic patient in ENT, what we have revised in the class beta. Diabetic patient MCQ from ear, which even they have asked you, is malignant otitis externa. MCQ from nose, answer will be here, mucormycosis. Always remember this point. Clear? So black, the word black is giving you the message. The area is necrose. So it will be necrosis on the nasal cavity or the facial. But if ear is involved, that is malignant otitis externa. Clear? Mucormycosis, which are the important points related with mucormycosis? Special affinity for the blood vessel, therefore it will block, it will cause necrosis of the whole area. Clear? Second point, the patient will be, the arteries are blocked, so patient will not be having like epistaxis or those symptoms. What will be the drug of choice? Even the examiner have asked you A65 next MCQ. This year they were asking the clinical related MCQs, like they have asked you the patient of mucormycosis, then they are asking the treatment of mucormycosis, liposomal amphotericin B. So for upcoming all the examination data, mucormycosis very important concept. Clear? Next, coming to the next question, number 9. A 60-year diabetic patient, again diabetic word, ENT, severe pain in the ear, granulation. So what is the concept? Just try to learn. Ear discharge with granulation, with facial nerve palsy. Diabetic word is mentioned, no other diagnosis except malignant otitis externa. Which are the 7 points which we have revised in the class notes? Ear discharge with granulation with facial nerve. This examination prove that beta. Gold standard class notes, revise them multiple revision, key to the success. First point. Second point, the patient is coming to you, what I will be going for, technetium 99 scan. Always remember, technetium 99 scan is for diagnosis, but if examiner asks you prognosis, we go for gallium scan. Yes, and what is the other point I taught you? If these scans are not available, patient can't afford, we can use ESR for the prognosis of the patient. Malignant otitis externa, which bacteria is involved? That is your Pseudomonas is involved. Therefore, what is the drug of choice? Drug of choice is always third generation cephalosporin. But if the patient is not responding, what is surgical intervention we can do? Only small procedure, that is your debridement. Debridement is done. So these are the 6 or 7 points which should be on your tips. So answer will be your B option. Coming question number 10. Very nicely formatted MCQ. Emergency tracheostomy. What is emergency tracheostomy? Any obstruction in the respiratory tract, above trachea, below trachea. Above trachea will be an indication for emergency tracheostomy. Patient is having surgical emphysema. Now what surgical emphysema? Why? It will be as a result of high tracheostomy. Why? Option A, high tracheostomy is related with carcinoma patient. Malignancy, we prefer high level. Low level, we are going for infections like diphtheria, having high risk of dissemination. Tight suture around the tracheostomy side, absolutely. Then there is a possibility whenever there some air is there, that will be leading to surgical emphysema. I feel this was the easiest MCQ, so option B will be the best choice. Tear to the posterior wall. If you will be causing a trauma to the posterior wall, it will not lead to surgical emphysema. It will lead to many complications, but not surgical emphysema. And what is the last option? Block. This was a MCQ which we were expecting, block in the tracheostomy tube. So two possibility: if total blockage, we remove the tube, and if it is partial blockage, we will do the suction. So this was the concept of tube blockage. So among these 4 options, the easy MCQ, this question we should not go wrong, because it's a simple surgical emphysema, because you have given tight suture. Clear? Option B will be the best choice. Clear? Coming on the next one, identify the X-ray. Again, even in the lectures, I have given you 4 X-rays. One was Waters view, broader face. One was Caldwell's view, long face. One was here lateral view. One was here basal view. And what they have shown you, they have shown you a very broad X-ray where they have highlight with sinus. They have highlight maxillary sinus. Will be going for Waters view. Waters view. Clear? It is best sinus for maxillary sinus. Sometimes the examiner asks you, if we ask the patient to open the mouth, what it's known as Pierce view. Expected point for the upcoming examination. Even they can ask you on this X-ray, which of the following sinus will not be visible, it is your posterior ethmoid. They can again ask one more MCQ on this concept, which of the following is the best X-ray view. Best X-ray view, open Waters view, open mouth. Waters view with open mouth is the best option. Clear? Nowadays we prefer HRCT. Therefore these x-rays, for the sake of MCQs, it should be on your tips. Clear? So coming on the next one, Caldwell's view. One option was there, Townes view and reverse Townes view. That is for your occipital area beta. Like Peter's bone, we want to appreciate like examiner ask you which of the following is the best investigation for Peter's bone. In Stallard, specifically we are going for reverse Townes view. Clear? So option A and D is related with the Peter's part, occipital area or Stallard bone. Clear? Waters view is your maxillary. Caldwell's view is for frontal and ethmoid. It is for frontal and ethmoid. Clear? Coming on the next one, ENT segment was very easy. Honestly, I'm telling you, as a faculty teaching for last 20 I will say beta ENT MCQ was scoring, and everybody will agree with me. Out of these 14 MCQs, you should not miss a single question. But a simple, straightforward MCQ. Now this is again one of the most, you can say, best formatted MCQ of ENT. Patient, emergency department, respiratory distress, cough, stipple sign. Stipple sign, I am a damn student. Stipple sign means laryngo tracheobronchitis croup. It means I have made a diagnosis of croup. Then I will close my eyes, a table where we have compared epiglottitis against croup. What we have learned in epiglottitis beta, yes everyone, epiglottitis infection, streptococci bacterial, therefore I will go for antibiotics. But in croup it is your viral infection, so we'll be going for conservative management. This type of point we have learned. So the word antibiotics will be ruled out. Wherever the antibiotic word is given, that will not be right answer beta. That will not be a right answer. If antibiotic word is there, that is for epiglottitis. So now option is, I can either go with the B option or D option. Antibiotics word clearly out. Option B and D. Now humidified oxygen with analgesia against conservative management. So we have written which word? We have written symptomatic treatment. So conservative management will be the best answer. So option D will be the best answer. Why with the need of giving analgesia in a patient of croup. So I will be ruling out the option B. So among these options, this was a very tricky question, beta. Tricky question. Many students, I was discussing this MCQ, many students will say, yes sir, option C seems to be best. No, not at all. Answer will be D option, beta. Very conceptual, logical. Again, class notes. Epiglottitis, antibiotics, croup, conservative management, symptomatic treatment. Clear? Coming on the next one of the easiest question. Patient have a mild hearing loss with nasal obstruction. Hearing loss with what examiner have shown you. Small blebs, small blebs with hearing loss word is mentioned. Always go for serous otitis media. But serous otitis media is not in the option. What is the other name we are using for serous otitis media? CSM, not at all. Otomycosis, no. Otosclerosis, no. Serous otitis media, secretory otitis media, blue ear and otitis media with diffusion. All are synonyms. Clear? So answer will be your D option. What is the treatment of choice? Treatment of choice will be myringotomy with grommet insertion. If required, we can go for adenoid surgery. Again, one of the easiest MCQ of the paper. Coming on the next question, a 7-year-old post-tonsillectomy patient is coming to you with complaining of snoring, palpitation, mouth breathing. School performance is on the lower side. Mother is worried. Patient is examiner is wasting their time. What is the next line in the management? Patient is having hearing loss. It means patient, the diagnosis, ear, mouth breathing with history of tonsillectomy, somewhere adenoid enlargement. Patient with middle ear symptoms are there. Which middle ear symptom will be there? Blue ear, because of ET2 blockage. So I will be going for adenoidectomy with grommet insertion. So among these options, the A option will be the best option. Again, a tricky question. We have to make a diagnosis of adenoid followed by ET2 dysfunction with blue ear. I'll be going for option A. Again, this paper have proved that we have to learn class notes. We have to write our notes. We have to revise them again and again. All my FMG students, beta, just focus on the concise revision, concise and revise of a gold standard class. Don't run behind the quantity, beta. Don't run. Just learn the quality notes, revise them multiple times. Clear? We wish you very best of luck, and we are confident that all the students who are working hard with us on this platform of eMedicoz, we are giving you the gold standard, very concise class notes, which will be more than sufficient for your upcoming FMG examination. So all you students who are appearing for the next examination, beta, learn, take a message from this discussion. Okay, we will focus on revision. You can ask your seniors, but every ENT question was from the class notes, so it is we have to stuck to the class notes and revise them multiple time. But very best of luck. We are confident all the students, dedicated students, will be getting a decent rank. Thanks a lot for listening to me. Any query you can ask me in the Exclusive Club 2022. Thanks a lot.